If you are a senior or a dedicated caregiver, you know the sound of midnight anxiety. It is a low, persistent hum of worry that settles in when the house is quiet and you're finally alone with your thoughts. It is the fear of a missed pill time, the dread of checking a blood sugar reading and finding a dangerous spike. It is the constant draining mental load of chronic care management. That relentless question, am I doing enough? Or worse, am I becoming a burden? This anxiety is not just emotional stress, it is an enormous and measurable medical risk. Health journals and the CDC have long reported that medication non-adherence, simply not taking pills as prescribed, is a primary cause of major health crises. This single point of failure is estimated to cost the American healthcare system between $100 billion and $300 billion annually. Think about that figure for a moment. Hundreds of billions of dollars wasted not on treatment, but on the downstream consequences of simple human error. More tragically, it contributes to over 125,000 preventable deaths every year in the U.S. alone. The system is failing to support the final, crucial step of care, compliance at home. This is not a failure of character or memory. It is a failure of the traditional system, which is complex, manual, and relies too heavily on human perfection in the most vulnerable moments. For too long, managing chronic disease has felt like a high-stakes, 24/7 guessing game where one small mistake can cost everything. Imagine the feeling of forgetting just one critical heart medication dose and the panic that follows hours later. That moment of realization is what we are here to eliminate. But what if I told you the solution is already here and it is simpler and more affordable than you think? The biggest breakthrough in senior health is not a new drug or a miracle surgery. The real revolution is technological integration. It is the creation of a simple, automated health command center right in your own home. This command center uses just three simple yet profoundly interconnected tech devices to give you and your family total, verifiable peace of mind. It is the end of the guessing game and the beginning of true self-reliance. Today, we will break down these three essential devices and show you how their synergy can build an impenetrable, full-time guard around your health in 2025. We will not just list gadgets. We will show you the exact blueprint for automated health management. Let us turn that midnight anxiety into quiet confidence. Part 1. The Anchor. Smart Medication Dispensers. We must begin with the ultimate defense layer, securing your medication routine. If chronic care has an Achilles heel, it is medication non-adherence. The statistics are sobering. The risk of hospital readmission rises sharply, by as much as 30%, when prescribed doses are missed or incorrectly taken. This failure point is often viewed unfairly as a user error. But the truth is, juggling multiple prescriptions with varying times and dosages is a recipe for error for anyone, let alone seniors managing complex schedules or mild cognitive decline. This is why the Smart Medication Dispenser is device number one in your command center. It is not merely an upgrade from the 7-day plastic pill box your grandparents used, the kind where dosages often get confused and pills fall out. It is a comprehensive, locked, and automated pharmacist on your kitchen counter, performing a critical task with clinical precision. These advanced devices, like the popular Hero or Live Find systems, eliminate human error and anxiety entirely. They perform the complex mental math so you never have to. The Smart Dispenser's value is built on three mandatory features that transform simple reminders into genuine safety protocols. Feature 1. Physical locking and security. This is a critical layer of safety, especially for seniors with cognitive challenges or those taking controlled substances. The system dispenses only the scheduled dose at the correct time, preventing accidental overuse or the temptation to catch up on a missed dose by taking more than prescribed. It secures the entire prescription supply, acting as a vault that protects against both underdosing and accidental overdosing. This alone is worth the investment for the peace of mind it provides against a catastrophic error. Feature 2. Multi-tiered persistent alerts. These devices understand that one simple chime is easy to ignore, especially with hearing loss or distraction. They use persistent audio alerts that increase in volume, flashing light displays, and often a spoken word reminder to make the pill time impossible to miss. If the pill is not taken, the device continues its escalating alerts until compliance is achieved. Or the next feature is triggered. They adapt the escalation sequence to the user's needs, prioritizing safety above all. Feature 3. Remote caregiver, alerting and reporting. This is the key insight for the family members watching this video. The device creates a digital record. If the senior misses their scheduled dose after the alert sequence is complete, the system sends an immediate, clear text message or app notification to the designated caregiver or family member. That notification is not a nagging reminder. It is an instant, actionable signal that allows for timely intervention from a distance. It is the difference between a minor schedule adjustment with a quick phone call and the catastrophic consequences of a critical medication lapse hours or days later. The accompanying app provides detailed compliance reports, allowing caregivers to review medication history, confirm adherence, and spot potential trends of noncompliance before they become medical emergencies. The Smart Medication Dispenser doesn't just manage pills, it manages the mental burden of adherence, allowing both the senior and the family to finally find genuine relief and confidence. It is the automated, trustworthy anchor that secures the entire health journey, reducing that $300 billion annual burden one compliant dose at a time. Part 2. The Real-Time Truth Teller, CGM. Our second essential piece of technology directly tackles the second biggest anxiety driver: uncertainty about chronic conditions, specifically diabetes and metabolic health. For millions of Americans managing blood sugar, the traditional method, the ritual of the finger prick, has been a painful, necessary evil, endured multiple times a day. But we need to ask a deeper question. Does this method actually provide the best data for preventative care? The answer is unequivocally no. A finger prick only gives you a single snapshot of your blood sugar at that precise moment. It is backward-looking. It tells you where you were 15 minutes ago, but not where your blood sugar is going over the next 3 hours. It is reactive care based on incomplete information, forcing you to constantly play catch-up with your own metabolism and diet. The solution is the continuous glucose monitor, or CGM. This small, easy-to-apply sensor, often worn discreetly on the upper arm, is revolutionizing how we approach blood sugar management. It is the real-time truth teller of your body. The emotional win of eliminating the painful finger prick ritual is profound for seniors, restoring a sense of normalcy and dignity to their daily lives. But the deeper clinical value lies in the trend data. The CGM delivers glucose readings to your phone or reader every few minutes, 24/7. You do not just see a high number, you see the upward trend before it becomes dangerous, giving you minutes or even hours to intervene with a snack, a walk, or a dose adjustment prescribed by your doctor. This is the power of proactive insight, prevention in real time. CGM technology transforms diabetes management from a frustrating, reactive game of chasing numbers into a proactive, intelligent conversation with your body. You can instantly identify exactly how stress, or a poor night of sleep, or even a specific food like white rice versus brown rice, impacts your blood sugar trajectory. For instance, you might see a spike not after dinner, but at 3 a.m. due to a phenomenon called the dawn phenomenon. This insight allows your doctor to make precise medication adjustments that traditional intermittent testing could never reveal. This is self-empowerment at its best. Furthermore, recent clinical adoption shows that CGMs are now being integrated by health-conscious seniors not just for diagnosed diabetes, but for a whole-body metabolic optimization hack. By tracking real-time glucose response, these seniors can fine-tune their nutrition to eliminate post-meal energy crashes, manage chronic inflammation, and most importantly, significantly improve deep sleep quality, which is critical for long-term cognitive health. The CGM offers a continuous, non-stop data stream of your body's most dynamic chemical marker, making it the most indispensable tool for real-time risk assessment and lifestyle management in the modern health command center. It ensures that when it comes to a chronic condition, you are never flying blind, and you have the data needed to take back control. Part 3. The Medicare Connection, Digital Vitals, and RPM. The final piece of this powerful system is the most financially astute, the link to your clinical care team, anchored by the Digital Vitals monitor. Specifically, we are talking about smart Bluetooth-enabled devices, a certified digital blood pressure cuff, and a pulse oximeter that meet clinical standards. We often assume the reading taken at the doctor's office is the gold standard, the absolute truth. But in reality, that brief reading is often misleading because of the common phenomenon known as white coat hypertension. This is the blood pressure spike caused by the simple, unconscious stress of being in a medical setting. Your reading taken at home, in a calm, controlled environment, is often far more accurate and reflective of your true cardiovascular risk over time. The American Heart Association strongly recommends regular home monitoring precisely for this reason, citing its superior diagnostic value for hypertension. The latest digital vitals monitors, such as those from Omron or Withings, seamlessly connect to your phone or tablet via Bluetooth or dedicated hub. They automatically capture your blood pressure, heart rate, and oxygen saturation readings. Crucially, they track the data trends, not just one day's reading, but a week's, a month's, and a quarter's worth of actionable information, establishing a true baseline for your health. This objective, longitudinal data is then securely transmitted via a HIPAA-compliant cloud platform, making it instantly available to your primary care physician or care team. This passive data collection transforms your home into a continuous diagnostics lab. But here is the most important part, the Medicare connection, which provides the financial incentive and the clinical continuity. This automatic data transmission qualifies many seniors for a specific, underutilized service called Remote Patient Monitoring, or RPM. RPM is not simply a piece of technology. It is a clinical service fully recognized and reimbursed by Medicare Part B. This is not a future promise, it is a current reality. By utilizing specific CPT codes, which are the billing codes used by medical professionals, your doctor's office can legally bill Medicare for the time spent monitoring and managing your remote data. Key codes like CPT 99453 cover the setup and training for the device. CPT 99454 covers the monthly fee for the device itself and the transmission of data. And most critically, CPT 99457 and 99458 reimburse the clinical staff for the necessary 20 or more minutes of non-face-to-face time they spend each month monitoring and managing your condition based on that data. This ability to bill for remote oversight is a complete game changer, incentivizing doctors to use the data you provide. The financial and clinical benefit for the senior is profound. Firstly, you receive a higher level of continuous or proactive care because your doctor is actively tracking your trends 24/7. They can often spot a subtle problem and adjust medication before a small issue becomes an emergency room visit. Secondly, and just as important, the Medicare coverage significantly minimizes expensive, unnecessary in-office visits and avoids the catastrophic costs associated with hospital stays caused by preventable medical events. The Digital Vitals Monitor is the powerful, financially intelligent engine that connects your home to the hospital, turning your simple daily 30-second measurement into a continuous reimbursable medical report. It is the essential link that transforms three individual devices into a unified, financially intelligent system, maximizing both your health security and your Medicare benefits in 2025. Conclusion: the Peace of Mind Blueprint. We have successfully built your ultimate health command center. The Smart Medication Dispenser is your security anchor, eliminating the anxiety and risk of dosing errors and notifying your family instantly. The Continuous Glucose Monitor is your real-time truth teller, providing proactive insight into your metabolism and empowering you to make immediate, informed changes to your diet and lifestyle. And the Digital Vitals Monitor, powered by Medicare-eligible remote patient monitoring, is your vital link to your care team, ensuring you receive continuous, professional oversight without ever having to leave the comfort of your home. This combined system is about so much more than just numbers on a screen. It is about reclaiming control over your body's data. It is about replacing the constant hum of anxiety with the quiet confidence of knowing everything is secured, tracked, and monitored. It is about the power to age in place safely, independently, and with the complete peace of mind that your health is being guarded automatically, minute by minute, day by day. This seamless, simple integration of technology is the definitive blueprint for managing chronic disease stress in 2025. The power to reclaim control over your health and happiness, or the health of a loved one, is literally right at your fingertips. Now, I have a question for you to spark our community discussion. If you could instantly eliminate one source of daily stress related to your health or the health of a loved one, what would it be? Would it be the worry about missed pills, the frustration of diet management, or the fear of an unexpected emergency? Share your answer in the comments below. Let's build a support community around it and share solutions. We have talked extensively about the enormous value and the clinical benefits these RPM systems provide, but what about the practical reality of the cost? In our very next video, we are going to break down exactly what you can expect to pay for the best systems, showing you how to navigate the monthly subscription fees and maximize your insurance coverage to minimize out-of-pocket expenses. Watch the real cost subscriptions for the top 3 RPM systems. 2025 Financial Breakdown next. Hit that subscribe button and notification bell so you do not miss that essential financial deep dive. Remember, this content is for informational purposes only and is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always consult your doctor or a qualified healthcare provider before making any changes to your medication or treatment plan. Thank you for watching and choosing to live proactively.